Hi, good morning, Professor. My name is Harpreet Kaur. Today I'm here to present my presentation. As you know, like we choose a topic community assessment for homeless teenagers living in the New York region. I'm the first group member. I'm going to show my slides. Firstly, I'm going to present my group members' name with their student IDs for Harpreet Kaur, Henrietta, Navneet Kaur, and Vajinder Kaur. Now I'm going to show my pictures, but like for the teenagers, and now I'm going to talk about the introduction uh, in the what we choose, like what we are going to explain in our presentation. During the 2021 count, the 360 teenagers were experiencing homelessness in the New York region. According to Gulf 2020-22, the total homeless currently at 1,300 could grow to more than 2,000 in 5 years, and at least 60% of homeless youth encountered violence, and a third of the teenagers also identify LGBTQ, and up to 40% youth experiencing homelessness were involved in the child welfare system. Homelessness is a critical issue in the New York region since the area experienced temperatures as low as minus 15 degrees. So, as you know, Professor, like in York region, homelessness is a critical issue. It's going to be increased. Now, according to like survey, it shows like it's going to be increased day by day. And so, how what this is all about my introduction. Now, I'm going to present my summary of community assessment. What we did in the community assessment. Firstly, I did a data collection method. Choose the how we can collect the data. Firstly, questionnaires through agencies and community groups. We choose the agencies and community groups. We can how in which way we can collect our data, and survey retrieved from the focus groups. We did this like we can do the surveys for collecting the data, interviews with individual teenagers affected by the homelessness problem, um, teenagers who are who are homeless. We can do interview with them, and we can how we can know the reason. We can get the solution as well for them. Review the existing reports about the teenage homeless in New York region. Observation of the situation at York region. We can observe the situation, what the situation is going over there in the York region for the homelessness. Thank you, Professor. This is all about my slides. The next slides will be described by my next member. Thank you, Professor.
Hi, good morning, Professor. I'm Navneet Kaur, and now I'm presenting on my topics on the York region in the the homeless teenagers. In this, as we all know, Harpreet told all the findings and the causes for the homelessness in the York region for the teenagers, and now I'm explaining the evaluations of the community selection. In this, as a nurse, as a a community nurse, like a homeless teenager in York region are the risk based on their living conditions because they living in a harsh conditions like in a very low temperature or in a very high temperature also, and they also feel the unemployedness, homelessness, and the health factors also. In this we can say that they suffer from many health conditions also, like as the respiratory conditions and all the things, and they always seek for the attention and the homelessness and for the food also. And in this their mental health also suffer from this impact, and the life expectancy and the mortality rate increases due to that reasons also. And after that, After that, after that I'm explaining my next slide. And in this it's a it's based on like a community description. In this we have to find the causes and the disparities, like the what the homelessness teenagers feel like in their living standard or in their like health conditions. In this, like violence also occur because of the minorities and to the elevated mental cases. And after that, the homelessness teenagers in the York region suffer from health disparities also, and of the environmental threats also. And after that, interventing of the homelessness will reduce cost of managing health disparities due to limited health needs. And it's all about my topic, professor. Now the other team members will explain it. Thank you.
Good evening, Professor. My name is Vajinder Kaur. I'm going to represent assessment strategies. First of all, race-based and identify data collection information retired from the strategy help nurse understand potential diversity and equities. These can include regular evaluation of the patient test, signs, and medical history, and so on. After that, socio-economic status scale, the lack of money by the homeless people and translate to low self-esteem, unhealthy physical environment, and lack of opportunity to participate in community life. This include various indicators such as income, education, occupation, and living conditions of the community members. The next one is educational assessment. Identify availability of life skills is necessary since it is necessary to make healthy choice. Like these can include traditional methods like exams, presentations, quiz essays, and other things. After that, collaboration with social services ensures promptly attending to the issues such as shelter, food, clothes, and it determine budgets for this community. It includes effective assessment strategies, also include critical thinking, problem solving methods, learning concepts, and so on. The next one is improving health equity, adapting human rights through attending to the basic needs such as shelter, clothing, food, healthcare, state, and homeless teenagers lack. Improving health equity involves addressing disparities in healthcare system and outcomes and opportunity among different population and other people. The next one is intervening across life course by criminalizing violence against minority populations such as women and LGBTQ. It includes ensuring equal access of the healthcare services, addressing social determinants of health such as education, income, and living condition for the population. Deploying targeting interventions such as relating and homeless teenagers to education for skills to make healthy decisions. Implementing a good policy to reduce the barrier among the care of the other population and provide proper clothing and treatment to the other people. The next one is conduct continuous monitoring and evaluation to ensure teenage homeless to revolve completely. Focus on the equity of a healthcare system because healthy mind resides in a healthy body, so it's very important to provide equal services to the all people to reduce the infection and other prevention which is very affecting the health of the other people. This is all about my topic. Next topic will be continued by the Henrietta. Thank you, Professor.
Hi, Professor. Like, as we all know, my friends described the other parts, like the improving health equity, the assessment strategies, and now I'm just define the conclusion, like how we overcome the teenagers that who are living like in a homeless way, like how we can overcome. In this, we can assess the highlight, like the vulnerability, like what's the reason causes for the teenagers, like how they can homeless and how they can suffer in the York region. and after that we have to provide the healthcare equity to all of them, like, and after that we have to give the interviews, reviewing the reports and survey to determine the severity of the social issues, like how we can overcome this problem. And we have to provide the sheltering also, like who suffer from that, and permanent options required, like a safe environment to the homeless youth, because we all know like the homeless are placed on the streets and they are suffered from many of the health conditions also. And after that the acknowledge root causes, and we have to find the root cause, what the cause of the homelessness, like how they can suffer and how they can feel, and we have to provide the sympathy also. And after that we used these references from this ppt, and hope you like it, professor. And me and my friends describe all the things, like how we can overcome and what's the reason of that, and how we can uh, assess the teenagers, like how they are homeless. And hope you like it. Have a good one, professor.